Prostitution and the risks they face. Prostitution, often referred to as the world's oldest profession, remains one of the most complex and controversial social issues globally. Many women enter sex work for diverse reasons: economic hardship, coercion, or personal choice. But regardless of motivation, they often face severe risks that affect their health, safety, and social well-being. 1. Health risks. One of the most significant dangers for women in prostitution is exposure to sexually transmitted infections, STIs, such as HIV, syphilis, and gonorrhea. Limited access to healthcare. 2. Physical and sexual violence. Violence is a constant threat. Many women report being assaulted by clients, pimps, or even law enforcement officers. Because prostitution is criminalized or stigmatized in most societies, sex workers are often reluctant to report crimes against them. This lack of legal protection. 3. Mental and emotional consequences. The psychological toll of prostitution is often underestimated. Feelings of shame, guilt, depression, anxiety, and post-traumatic stress disorder, PTSD, are common. Rejection by family or community can deepen isolation, leading to substance abuse or suicidal thoughts in extreme cases. Social support networks for these women. 4. Legal and social stigma. In many countries, prostitution is either illegal or heavily regulated. Women caught engaging in sex work may face arrest, fines, or imprisonment. Even in regions where sex work is decriminalized, the stigma persists, limiting women's opportunities for education, employment, and housing. This societal judgment traps many in a cycle of poverty and marginalization. 5. Economic exploitation and trafficking. Some women are forced into prostitution through human trafficking or deceptive recruitment. Traffickers exploit vulnerable women, often migrants or those from impoverished backgrounds, promising jobs or better lives but instead coercing them into sex work. In such situations, women lose autonomy and are subjected to physical and psychological abuse while receiving little to no compensation for their labor. 6. Pathways to safety and empowerment. Addressing the risks faced by women in prostitution requires multifaceted solutions. Decriminalizing sex work can improve access to healthcare and legal protection. Support services, including counseling, education, and job training, can help women transition to safer livelihoods if they choose. Most importantly, society must replace stigma with empathy, recognizing sex workers as human beings deserving of dignity and rights. Conclusion: women involved in prostitution face an array of health, safety, and social challenges. Whether through choice or circumstance, they occupy one of society's most marginalized positions. Effective solutions require compassion, legal reform, and access to resources that empower these women rather than punish them. Only then can their safety, rights, and humanity be fully protected.